client privacy, confidentiality, and HIPAA. Respecting a client's privacy and protecting their personal information are not just ethical responsibilities, they are legal requirements. As a home health aide, you are entrusted with access to private health and personal information. This lesson will teach you how to handle that responsibility professionally and in compliance with federal law, specifically the Health Insurance Portability and Accountability Act. This lesson focuses on understanding what privacy and confidentiality mean, how HIPAA affects your daily work, and what actions are required to stay compliant and trustworthy. Understanding privacy and confidentiality. What is privacy? Privacy refers to a person's right to control who sees or knows about their body, belongings, and personal life. Examples in home care: ensuring doors are closed during bathing, not talking about the client's health around others, respecting their decision to refuse care. What is confidentiality? Confidentiality means keeping private information private, especially medical and personal details. Examples: not sharing medical diagnoses with unauthorized persons, not discussing client conditions with neighbors or other clients, avoiding gossip or careless conversations. These are basic human rights that also align with professional and legal standards. Introduction to HIPAA. What is HIPAA? HIPAA stands for the Health Insurance Portability and Accountability Act. It is a federal law passed in 1996 to protect sensitive patient health information from being disclosed without the patient's knowledge or consent. Why it matters. HIPAA applies to all healthcare workers, including HHAs. Violating HIPAA can result in legal action, fines, or job loss. Clients trust HHAs with their health information. Protected Health Information, PHI. HIPAA covers PHI, or Protected Health Information, which includes medical records, diagnoses, test results, health insurance information, anything that identifies the client, name, address, date of birth. Guidelines for protecting PHI. Do: share information only with authorized healthcare team members. Store written records in a locked or secure area. Log out of digital systems when finished. Speak quietly when discussing client information. Do not: leave records out where others can see. Share client information over the phone unless verified. Talk about the client in public or with unauthorized people. Text or email client information using personal devices. Phone example: if a family member calls and asks for the client's medical update, you must confirm they are authorized. Direct them to the supervisor if unsure. Never disclose details over the phone without permission. Applying privacy principles in the home. Respecting physical privacy. Knock before entering a room. Drape or cover the client during bathing or procedures. Provide privacy during toileting and dressing. Avoiding casual violations. Don't talk about one client with another. Avoid posting about work on social media. Never take photos or videos of the client, even if they say it's okay. Remember, intent doesn't matter. If the action violates HIPAA or the client's dignity, it's wrong. What to do if privacy is breached. If you make a mistake, report the breach to your supervisor immediately. Do not try to hide the error. If you witness a breach, speak with your supervisor. Document what happened factually. Handling violations properly helps maintain a culture of safety and professionalism. As an HHA, you are expected to be both compassionate and legally responsible when handling client information. Respecting privacy, protecting confidentiality, and understanding HIPAA are essential parts of your job. Even simple acts like closing a door or keeping records secure can have a major impact on client dignity and trust. By mastering these principles, you'll not only follow the law, but also support the emotional well-being of those you care for.